That's right. Typically, you can receive a vaccine through the hospital, the local health departments, or local pharmacies. Well, right now, the COVID-19 vaccine is only accessible through the hospital or through local health departments. And for rural communities, that could mean a 30 to 50-mile drive into town just to get vaccinated. It's been just over 2 weeks since doses of the COVID-19 vaccine arrived in Utah. And though there's a large supply, it seems to pale in comparison to the urgent demand.
Each one of us will face a unique set of challenges. For ours is getting that messaging out to a group of people that may not be able to travel. They live in far-flung places. How are we going to get access to them?
Braden Bradford, executive director for the Southeast Utah Health Department, says their region covers about 40,000 people. So far, they've received 1,100 vaccines and distributed 450, or about 41% of them.
It's been a little bit of a tough week in our rural area. A lot of those offices shut down between Christmas and New Year's. I know that's not unusual in other places as well. So we don't really have access to get to those employees.
They're hoping to get additional doses next week, and with a full staff back in the offices, hoping to administer hundreds of more vaccines.
There has been some hesitancy to that level, but most of them say, I think I want to get it. I just don't know if I want to get it right now.
Bradford says they anticipate challenges scheduling 200 folks for doses a week, especially when that 200 turns to 400 as they administer the second dose. Bradford also has concerns about what would happen if their supply runs out.
If it's open, for example, to people 75 and older, how do we schedule those when we only have enough for 200 per week or so?
In comparison, the Southwest region, covering Washington, Iron, Kane, Beaver, and Garfield County, only 7% of their nearly 10,000 vaccines have been administered. There are 5 clinics for the 230,000 people living in the area. Fox 13 was told the health department has not started administering the vaccine, accounting for the small percentage. Both regions plan to use mobile units in addition to their clinics.
But at least you don't have to travel 30, 50 miles.
A drive they hope folks won't have to make, but say it's worth it for the vaccine.
Healthcare workers come in shouting for joy.
Now, something state officials have also mentioned is they typically receive federal assistance to distribute and administer vaccines. And this time around, it's left to the states to come up with their own programs to distribute and administer the vaccine. All the health departments that I have spoken with say next week is the big week for everyone to get vaccinated. Live in Murray, Aaron Cox, Fox 13 News, Utah.